Dr. Emanuelle Waubant is a neurologist who specializes in treating patients with MS, and she also serves as the director of the UCSF Regional Pediatric Multiple Sclerosis Center. I thought a good place to start is to ask you to explain what ACTRIMS is and what the ACTRIMS Forum is all about.
ACTRIMS is a scientific organization that organizes not only scientific meetings like we're in today, helping people to share their discoveries, making connections, develop collaborations, but also foster the career of future scientists.
And talk a little bit about what the ACTRIMS Forum facilitates.
The meeting facilitates really state-of-the-art presentation of top-notch science in the field. So it's very timely. We usually favor kind of more junior scientists or even senior scientists, but with novel projects. And so lots of what I've heard today, for example, I had not heard before, which is really very refreshing and very exciting.
One of the things that happens at the ACTRIMS Forum is the awarding of the Barancik Prize for Innovation in MS Research, followed by the winner delivering the Barancik Lecture. You remember the panel that selected this year's winner, Dr. Mika Siemens. What was it about Dr. Siemens' work that you found so interesting?
I found that his research was different from typical research because not only he started by identifying how myelin sheets form and how they may decay or undergo kind of destruction and then remyelination, but then throughout his career, he transitioned to continue being involved in glial cell biology, but bringing in the immune system in his research. So he's really had a very nice, trajectory over the years of focusing really only on oligodendrocytes and what they build, but also then encompassing something much more complex with the immune system.
You're the founder of the UCSF Regional Pediatric Multiple Sclerosis Center. There was a time when pediatric MS wasn't even a consideration. Obviously, that's changed. What can you tell us about advances in pediatric MS treatment and care?
I'd say the first advance is that we're diagnosing earlier. I think there's been an increase in the awareness in the community that it exists, and we did a lot of education of not only child neurologists but also pediatricians. So when they see those patients, they can identify something's going wrong with possibly a disease like MS. So I think that that's the first thing. The second thing was to treat patients. And very early on, people were very shy about using more potent medications for pediatric MS because there was a concept that I think is now been proven erroneous, which was pediatric MS is benign. And the reason why people thought it was benign is because those patients took longer to reach similar level of disability, but the truth is that they reached a certain level of disability at an earlier age, disrupting their family life, their social life, their work life. And so now there's a recognition that pediatric MS is not benign, that it is a disease that has to be treated in most cases, and people feel more and more comfortable with using more effective medications early on. So that will really help those young patients to develop very fruitful lives as young adults and older adults.
Full transparency, you diagnosed my wife with MS when you were a clinical research fellow at UCSF. You've made multiple sclerosis the focus of your clinical and research career. What was that about multiple sclerosis that initially attracted you to it?
I was mesmerized by neurology since my second year of med school. And then throughout med school and residency, actually even before residency, I was very interested in the immune system. And so the crossroad when I became a neurologist was really, there's not that many immune diseases in neurology, and I liked working with patients who had MS because lots of them were young women, and as a young woman, I could really identify myself. And at that time, the field was mostly male physicians. There was a difficult time discussion with these young women, like they were told, well, you should not have children, you should not have a job, quit your job now. And I felt that was wrong. And that's why I really felt very strongly I was interested in working with young patients. I mean, not only women, of course, but working with young patients, trying to diagnose earlier. And at that time, there was no real treatments. But then when I became junior faculty, interferons came in. So it was really transformative.
You also serve on the executive committee for the International Women in Multiple Sclerosis. What can you tell me about that organization?
I started International Women in MS in 2018 with a few of my colleagues because there was some frustration about the lack of diversity in representation of not only women but other minorities. And we felt that at meetings or in committee, grant review committees, or speakers or chairperson or kind of leadership position in the field, it was very demoralizing for women to be sitting in an audience and see that they were mostly male speakers. And for a disease that affected more women, we felt that things had to change. And so we kind of rallied forces from women from different countries because this was something that was happening not only in the US, it was happening across the world. And we identified what we thought had to change, and we identified ways to change it. And we very systematically took the approach of, well, we're going to help mentor young faculty, or even before their faculty, like when they're postdocs, when they're fellows. So we help them navigate their career choices. We're going to help those junior researchers to actually have international talks through our scientific talk series. So they could have that on their CV as an international talk. They could also, through these meetings, develop connection and collaborations, and it cost nothing. It was free. It was all Zoom-based. And we also developed partnership with different scientific organizations to review with them why we thought women and minorities had to be more involved in any level of their committees, their speakers, their chairpeople, and so on. I think we've seen tremendous changes.
I was about to agree with that for sure. What do you see in MS research today that particularly excites you?
What excites me from a research standpoint is the fact that there's new cells like astrocytes or microglia that are now becoming really very hot in the field, and there's a lot of work to try to understand their role in MS, not only for the inflammation, but also maybe the repair in the disease. So that I find that really fascinating and very exciting. I'm very excited also about all the possibilities of maybe remyelination, so repair of the myelin, or neuroprotection.
Well, Dr. Emmanuelle,
lots of interesting topics.
Lots of them. Well, Dr. Emanuelle Waubant, I want to thank you for all you do to improve the lives of people who are living with MS, and thanks so much for talking with me today.
You're welcome. It's a pleasure to be here.